comfortable posture. Find a comfortable posture for your meditation. There's basically two things that matter about the posture. We want to be comfortable enough that we won't need to move, but not so comfortable that you will fall asleep. So the more tired you are, the more uncomfortable of a position you might want, stretching your back out. I'm crossing my legs because I, unlike most people, find this comfortable. If this isn't comfortable, sit in a way that's comfortable. And we'll start the way meditations often start, just by bringing your attention to your breath. Placing the breath in the center of your attention. And try to keep everything else in the background. So the same way, if there's birds or traffic outside, you don't need to go ask the traffic to stop and shoo the birds away. It'd be very easy to follow what I'm saying, even if there's noise outside. But we'll try to treat noise inside just the same way. Don't try to stop thinking. If there's thoughts, put them in the background. Get the attention on your breath. So I'm going to suggest two other things you can do in the meditation. They're both quite a bit more challenging. So if you're new to meditation, if you're new to meditation, you may actually just want to keep going with your breath. If you're up to a bit more of a challenge, what you can try is still holding your breath in there somewhere and trying to listen to your thoughts just like sound. The same way that if you hear a car go by, you might know that there's a car going by, but you don't think about whether it's a lorry or a car. You don't try to figure out whether it's an airplane or a helicopter. There's a way of listening to the noise on the street where you would know precisely what it is. And there's this other way where you just kind of leave it in the background. You know it's there and you don't care. Sometimes I think about Charlie Brown's teacher, the way she just sounds like a clarinet. So we'll do three parts to the meditation. The first one is putting the breath in the center. Feel free to stay with that. If you want to try the second part, it's keeping some attention on your breath and try to listen to your thoughts just like background noise. So if I asked you whether you were thinking or not, you'd be able to answer that question. Same way you could tell me whether it's loud or quiet outside. you're probably not paying any attention to what's going on outside. It can help to keep the breath more central in your attention. It's just a pretty small tweak from the usual breath meditation. Usual breath meditations put the breath in the front, everything else in the back. This is the same thing, but uh, all you really do is choose to notice what's going on with your thinking. And to me, at least, this feels pretty lovely. Usually, if there's nothing to do, sometimes even if there's plenty to do, my attention's on my thoughts. My thoughts, probably like your thoughts, are all over the place. And so my emotions go all over the place. Right now, I can hear my thoughts, but I'm not paying any attention. And so there's this freedom from my thoughts. And it doesn't matter what they're doing. Same way, I can hear some noise from traffic outside. It doesn't impact my life in the slightest. Does it make my day better or worse? We all, I imagine, have freedom from the sound of cars passing outside. Treating your thoughts this way, you get that same sort of freedom. For the last part of the meditation, I'll suggest one more technique. It's harder than the first two, so same thing. If you're new at this, or if your mind feels new at this evening, feel free to stick with one of the earlier techniques. If you want to try phase three here, continue focusing on your thoughts. You can drop the breath, but this time actually listen to what your thoughts are saying. You want to listen to what they're saying in the right sort of way. You want to listen to your thoughts the way you would listen to the radio. The radio is something you are listening to. If you get distracted here, some people will get lost in images, but most of us will be focusing on our thoughts still. So getting distracted here, for the most part, means focusing on your thoughts in the wrong way. The two ways where you're trying not to focus on thoughts is imagining that you are the DJ. You're inside the radio. We're not the speaker of the thoughts, we're the listener of the thought. We also don't want to start yelling at the DJ. I don't know about your thoughts. My thoughts often say things that are quite inaccurate. And we don't want to talk back to the thoughts. So, whereas before we were deliberately trying to treat the thoughts like sound, not know what they're saying, for the remainder of the meditation here, try to actually just listen to your thoughts. You hear the term non judgmentally very often in meditation circles. What that means here is your thoughts are often not accurate. Uh, Many people's thoughts are often not nice. And we won't try to make them accurate or nice. Try to just listen. You could imagine compassionately listening. My thoughts aren't very smart. They're not very nice. They're pretty repetitive. And if I think of somebody who's not very smart and very repetitive starting to talk to me, I could get irritated. I could also get this kind of compassion where I'll give them some time to get this off their chest. It's the way you want to try listening to your thoughts. So in phase two, if I were to tap you and say, were you thinking or not thinking? You would have known the answer. If I said, what were you thinking about? You actually may not have known the answer. For this part, imagine that I might ask you what you're thinking. I won't, of course. But imagine that I might ask you what you're thinking. And so you want to listen well enough that you'd be able to answer the question. Sometimes when you deliberately look for thoughts, they get silent. If you're not having any thoughts, you can keep your attention in the area of your head where your thoughts would be. Pretty much everyone I know feels their thoughts coming from somewhere in their head. I don't know anybody who thinks their elbows are having thoughts. Thanks, everybody. So, for those of you joining us later, what I'm gonna do now is read. Oh, hi you. I know you. I'm gonna read the introduction for my book. It'll take about 10 minutes, and you'll probably see what the book has to do with what we just did. And then I would love to take questions. So if you're on the internet, feel free to type them to Man here. And when we finish up, we have a bunch of books in the room if anybody wants to buy one. You can also buy them on Amazon, but it's quite a bit cheaper to buy them here. So if anybody on the internet is like just down the street, feel free to come over if you want. We can stay a few minutes late. The book is called Sanity and Sainthood, and it's written in two voices. Only one of the voices is nice. So, what's this book about, anyways, Tucker? What a great opening question. This book is about what happens when Western lay people practice intensive meditation and how different the results are from what they're generally told will happen. Both modern teachers and ancient Buddhist texts tell you that with sufficient meditation practice, you'll become enlightened. Once this happens, your psychological issues, and maybe your whole psychology, will evaporate. You will feel just the way you want to feel all the time. This is a totally wrong definition of enlightenment, at least in terms of what's possible for any of the thousands of people I've spoken to in my 2 decades as a meditation practitioner, teacher, and clinical psychologist. Instead, I define enlightenment as a state in which both objects of consciousness and states of consciousness continue their constant fluctuation, all the way from very pleasant to very unpleasant, and you no longer do anything stupid to try to make this fluctuation stop. Small amounts of meditation are relaxing, and large amounts of meditation, like retreats, lead to all sorts of awesome states of consciousness and insights. But as you continue meditating regularly, most practitioners will find that meditation brings up psychological content like strong memories, emotions, and trauma. This can often leave you feeling worse than you did beforehand, sometimes much worse. Why does this happen to us? The Buddha says that in addition to developing mindfulness, your meditation should also develop clear comprehension. By that, he means that you know what's going on in your mind, and when you get a clear sense of how your mind is functioning, you may find that the answer is badly. Not only have we spent our lives living and acting in ignorance, the Buddha said, we've actually been doing this since the beginning of time. And to make matters worse, in Buddhist cosmology, time doesn't even have a beginning. While your first retreat might leave you feeling wonderful, over the course of multiple retreats, you might actually start to feel the truth of the idea that you've been walking around, acting foolish and insane since the beginning of beginningless time. There's a little footnote here where it says, I use the word feel because I don't know what happens after you die or what you were before you were born. It's just that it can feel as though it must have taken multiple lifetimes for your mind to become as confused as it is. Meditation gives you access to deep parts of your psychology that are generally hidden. This will make you wonderfully powerful when you start working on these issues and fixing them. The problem comes if you think that either you're failing at meditation or Dharma doesn't work because you're still having lots of negative emotions, or if you think that if you just keep meditating, these problems will go away. In fact, your practice is working great if it's giving clear comprehension. And if you ignore this mental content and just keep meditating, your mind and frequently your body can become more and more messed up. I've been a clinical psychologist for my entire career, working with thousands of clients over tens of thousands of hours. I specialize in treating advanced meditation practitioners. I've also taught over 60 residential meditation retreats. So I spent an awful lot of time observing and thinking about the interaction between intensive meditation practice and psychology. What I found is that we need a better map for the changes that happen during meditation and as a result of regular meditation. Gaining clear comprehension, insight into how our psychology works, can be incredibly powerful. When we don't have a map, it's easy to fall prey to the myth that awakening means our psychology disappears. This myth, which is all too common, has hurt many of the students I know. Too many of these regular meditators have become more and more miserable and unstable. Yet they felt the need to hide their problems from their teachers and their community so they could appear to be good little Buddhists, or their teachers have told them it's a dark night of the soul and they should just keep meditating. More on that later. I've also seen this myth do great damage to spiritual teachers. I often ask my students to do a little exercise. Think of the first 10 spiritual teachers who come to mind and put up a finger for each one you can think of. Now put down a finger for each teacher who's had a major scandal around sex or money. A bunch of fingers often go down. There are numerous reasons these scandals occur, which I'll get into near the end of the book. One of the most common is that teachers come to believe that since they're so good at meditation, their psychology must be whole and healed, and their actions must be enlightened actions. Instead of developing clear comprehension of all the flaws in their psychology, they ignore all the flaws in order to maintain their own myth that the flaws no longer exist. When you give lots of power to a person who's training not to notice their true motivations, and then surround them with people who think they're enlightened beings, it's unsurprising that lots of problems arise. The solution to these problems, the map I've used in my teaching and clinical practice, is to integrate psychotherapy techniques into meditation practice. Head to a bookstore these days, and you'll spot shelf after shelf of Buddhist books, but you may not find others that offer instructions on how to combine intensive Dharma practice with psychotherapy, or provide a map of what you might expect to happen when you do. When distinguishing Dharma from psychology, the concept I'll return to most frequently in this book is the difference between focusing on mental process and mental content. Content is what is happening in your mind, whereas process is how it is happening. I can ask you what you're thinking about right now, and you can tell me. In that case, your answer would be the content of your thoughts. Oh no. Oh, okay, I found it. We're back. I can also ask a huge number of other questions about your thoughts, such as how much time exists between the thoughts, the volume of the thoughts, are they screaming or whispering, what happens to your thoughts as you shift your attention, and so on. All of these questions are ignoring the content of your thoughts and instead focusing on the process of how you are thinking. While it's an oversimplification to say Dharma is about focusing on mental processes, whereas psychotherapy is about focusing on mental content, this is close enough to true that I think it's a helpful heuristic to keep in mind as you're reading. Over the course of the book's 5 sections, I'll lay out how I weave the two together in both my Dharma teaching and my psychotherapy practice. I'll start with the Dharma, talking about both the basics of Buddhist thought and practice as it's come to us through the centuries, and then how it interacts with Western belief systems. I'll describe core ways of approaching meditation and the meditation techniques that my students and I use. I'll also talk about what these techniques do and don't do, and why psychotherapy approaches can address those gaps. Then I'll run you through basic schools of psychotherapy and a few techniques that have become central to my own work and teachings. And I'll circle around one of the key focal points of both approaches, the ego, what it's good for and how it can really make us miserable. I'll also talk about how to tap into our physical sensations during meditation, to bring awareness to all the painful emotions and memories that our ego is both suppressing and reacting to. The last 2 sections of the book then lay out a path forward, healthy ways to approach meditation, the Dharma, and psychotherapy, blasting through myths, avoiding unhealthy behaviors and even unhealthier teachers, and finding the true gifts that regular, sustained meditation practice, complemented by therapy at the right times, can bring into our lives. I've still only got a vague sense of what this has to do with sanity, not even a guess about sainthood. You should probably tell your readers about that. Sanity, the goal of psychotherapy, is the state or trait in which your emotions are generally reactive to the outside situation. If your life is pretty good most of the time, then a sane person would feel pretty happy most of the time. Insanity, in this sense, would be the nearly ubiquitous situation in which your emotions respond to internal sensations that have little to no grounding in the real world. For instance, someone might give you negative feedback on your actions, and what you hear is something like, "You are a bad person," and then you slink off feeling like a bad person. Or the feedback might remind you of someone in the past who disapproved of you, which would trigger the trauma of a harmful childhood relationship as though it were happening right now. Or you might have some tiny pain, but you start thinking that the pain might be a huge problem, which it isn't right now, and then your emotions respond as though you're having severe pain. On the flip side, something really wonderful might happen to you, but you're so closed off from your own emotions that you hardly experience any positive internal states as a result. Most of us are responding to things that didn't really just happen. Instead, we're responding to fictional things that our mind has invented. I'm defining sanity as a cessation of this, where your emotions track what's actually happening in your life. It sounds like you're calling pretty much everybody insane. I do, in fact, mean that everyone is insane in a sense, yes. The base state of most human minds is insane. Sanity takes some training. And sainthood? Sainthood, for me, is the goal of Dharma practice. I define sainthood as a state in which we've overcome all of the internal obstacles to being an exceptionally moral person. This is a much clearer goal than awakening. You'll rarely find two teachers who agree on the meaning of that word. Sainthood is a loftier goal, and it's easier to ascertain which students and teachers have made good progress moving towards it or regression away from it. In my own experience, as Dharma helps me decrease my delusion and cravings, I'm becoming a better person. My aspiration isn't just to feel awesome, but to be a really, really good person. This is why I think of sainthood as the goal, not just a happy, imperturbable mind, or lasting alteration in the sense of self, or any of the more common definitions of awakening we come across. Well, I guess I'd read a book about sanity and sainthood. Okay, great. One question though, who are you? I'm an alter ego you've invented to help you write this book. It's a pretty trite rhetorical gimmick, especially if what's supposed to be a spiritual book, but I'll do my best. Okay, thanks. Do you have a useful question then? Sure. If you're writing this book, are you some kind of sane saint? For most of us, sanity and sainthood are directions to move in rather than goals to actually achieve. So the question I always ask in my own practice is, relative to a few months ago, am I closer to these two than I used to be? While I make no claim to either state, not because I'm humble, but because I assure you I haven't reached either state, the answer throughout my 20 plus years of practice has been yes, I'm getting closer. Let me show you what sorts of ideas and techniques can help you do this too. And sorry, I'm going to stop reading. I'm going to leave you with the cliffhanger there. So the meditation that we started out with was first focusing on process, right? So you're ignoring your thoughts. You're aware when thoughts are absent or present. The easiest way that I like to think about content versus process, content is what's happening, right? So in the second phase there, we were listening to the content of our thoughts. What's it about? If you hear two people arguing, what you'll do is listen to the content. You'll try to see what they're saying and try to figure out who's correct. Now imagine that they're arguing in a language that you don't speak. What are you going to do now? You can't listen to what they're saying. You don't know what they're saying. You're going to automatically start watching how they argue. Like, is this one dominant and this one submissive? Maybe this one's dominant for long enough that this one flips and becomes the dominant one. That's something about how they're arguing, right? Process is generally what you see when you ignore content. And process is generally invisible when you're looking at content. If you're listening to what the two people are saying, you're probably not analyzing how they're arguing, right? And as soon as you can't listen to what they're saying, all there is left to do is analyze how they're arguing. In Dharma practice, in traditional Buddhist teaching, there's very little focus on content. Who here's been on a meditation retreat before? Cool. So particularly if you've gone with a traditional teacher, particularly if someone who trained in Asia, if you go in to meet with your teacher and start telling you about the content of your thoughts, they're going to find a polite way of telling you to shut up, right? They don't want to hear about your thoughts. You're not supposed to talk about it. They're going to tell you this is moha, delusion. This is leading you further from awakening, and you should ignore your thoughts. If you go to a therapist, it's the exact opposite, right? There's a line in the Buddhist suttas, the oldest, the Pali Canon, it's the oldest text that we have that are attributed to the Buddha, where a few times the Buddha says, do not say he hit me, he robbed me, he abused me. Someone who speaks this way is already in the grip of Mara. Mara is like Satan in Buddhism. Imagine going to your therapist and saying, I've been abused, and them telling you, don't even talk about that. You're in the devil's grasp as soon as you mention this. It's really the opposite. When you go to therapy, we really want to know what is going on in your mind. so we can see if we can make your mind work any better. The Buddhist angle is, look, this is a losing game here. Your mind doesn't work well. It won't work well. Try relating to it differently, and then you have freedom from all the delusions that your mind is creating. Where I think this approach isn't complete, at least for most of us here in the West, is a few things. One is if you do a lot of meditation, has anybody been on multiple retreats? Cool. So you may have experienced, if you've been on multiple retreats, you start getting a lot of emotions. Not true for everybody, but true for most of us. Your practice starts becoming about feelings. Uh, if you've done a Goenka retreat, particularly day 3 and 4, most people are not calmly focusing on their breath like you see on the advertisement for the Goenka retreat. Right? People are crying on day 3 and 4. So one issue is a lot of the psychological content just shows up as you meditate. And if you just ignore it, sometimes it will go away. Other times it really doesn't. Other times it actually just gets stronger, gets worse, gets more disruptive. The other reason I think both approaches are necessary is while it is true that you can't make your psychology work the way you want it to, you certainly can make it work better. I've been a psychologist for a long time. I spend my days not making people perfectly sane, but I do spend my days helping people's minds work better than they used to. And so this is the way that I tend to think about healing the human mind, is focusing on mental process is better. The Dharma route is better. The reason is the problems in your mind, no offense to anyone present, are numerous and diverse. And so to fix uh, your self-esteem might take a while, and then you might need to fix your marriage, and you might need to fix issues from your childhood, and so on. Each of these things requires its own fix, right? Whereas if you focus on process, if you just ignore the mind, as you'd often be taught to in Dharma, if you just relate to it differently, it actually doesn't matter how numerous or how diverse the problems are. You can relate to them all with, sometimes I like to talk about Dharma as the original one simple trick clickbait. One simple trick for all suffering. Stop craving. The Dharma route is better. It's addressing all of the problems at once. The trouble is, for most of us, it's not complete. And so the mantra that I use to describe how I think about this interaction is, when you're trying to improve how your mind works, focus on mental process whenever you can, and mental content whenever you have to. Have to meaning the same psychological content is just coming back and back in your meditation, or it's so overwhelming you really can't do anything else. In that case, you may want to work directly with the content. There are some meditation practices to work with the content, although it's hard to replace a professional therapist or a coach helping work through the content with you. What I'd like to do with the second half of our evening is hear what's on your mind. So what I want to do is open for questions. And I have one rule that I always like to give about questions, which is they have to actually be questions. Sometimes you go to a Q&A and somebody starts telling you their whole life story. So I'd love to take as many questions you have, as long as they are, in fact, questions. Would anybody, let me start in the room here. Would anybody have anything on their minds?
I'll start off.
Thanks. Usually once the first question comes, then the other ones start coming.
So I'm just wondering, day to day, in terms of when you're at work, you're carrying out your day-to-day activities, and you notice these thoughts and the mental processes going on. What is something that you can do straight away to tackle that, or how do you combat some of those processes?
So How do you, in day-to-day life, how do you combat these neurotic mental processes?
Yeah.
Um, I think step one for psychological healing is knowing truth from fiction. Meaning, if the thoughts are something like, I'm failing at work or I'm failing at school, and that thought is true, there's a really different flow chart for what you should do with it if that thought is false, right? Uh, a lot of times people's automatic thoughts are about whether people like you, you know? And so if you start having thought that people don't like you, and people actually don't like you, what you should do about that is very different from if actually most people like you most of the time, and the problem is you're having this distressing thought, right? It doesn't really solve the emotional problem often at all to know truth from fiction, that you might know that some people like you just fine and feel like nobody likes you at all, right? So it doesn't solve the problem, but it's the necessary first step. So once you know, okay, these thoughts are false, then it becomes possible to treat them as thoughts. The problem is I'm having distressing thought. If you're if you're going about your daily life, generally there's some object of attention determined by the situation, right? So right now, in theory, you should be focusing on me. That's why you came to the talk. It'd be a little silly to come here and not focus on me. Of course, you can't do that all the time. Your attention gets lost. But when you're driving home, the goal would be, of course, to focus on the road for your own safety and the people around you. When you're washing your hands, you can focus on what your hands feel like. So in daily life, most of the time, there's some object of attention. What determines how you're feeling is primarily the object of attention, right? So if maybe like your pants are a little too tight and you're focusing on how that feels, and I say, how are you? You're going to say, lousy, I'm uncomfortable, right? Unless your pants are really tight, you weren't focusing on that until I brought it to your attention, right? You're focusing on me. And so the question of how you're feeling and how your evening's going is basically a question of, do you like this talk, right? As soon as you're focusing on me, it doesn't really matter if your belt is too tight. What's determining your emotional state is primarily what you're focusing on. And so what I would suggest in daily life is pick a good thing to focus on. So we can hear there's a motorcycle coming by right now. It was actually pretty loud. How many people noticed the motorcycle until I told you it was there? Okay, cool. Who got distracted by the motorcycle? Lost what I was saying. Nobody. That's what I thought. So the motorcycle is pretty loud, but it's actually pretty easy to just focus on the talk. And it doesn't matter if you hate motorcycles and you think the government should ban them or whatever. It's not affecting your feelings, right? So this would be my main piece of advice is figure out whether the thoughts are false. And if they are, see whether it's possible to not listen to them. This will not at all solve all of your psychological problems, certainly. But if you're like having your lunch, it's not going to be possible to cross your legs for a 45-minute meditation or call your psychologist or something like that. So in your daily life, I think that's your best bet. The same way that you could hear, well, a few of us heard the motorcycle, but you just leave it in the background and then it doesn't affect you. That's how I try relating to the thoughts and emotions and other distressing insanity that shows up during the day. What else?
If there's no questions here, there's some questions online already.
Yeah, let's do it.
So, so someone's asked, how do you reprogram automatic negative thoughts and how do they influence mood or feelings?
Great question. How do you reprogram automatic negative thoughts? So there's a lot of different techniques for that. I can give you my favorite. The first is cognitive behavioral therapy. This involves getting really clear on truth versus fiction. So if you go to see a therapist for CBT is the acronym. If you go to see a therapist for CBT, one thing they'll often do is give you a thought diary. They used to be pen and paper, now they're on your phone. And what you do with the thought diary is when you have a negative automatic thought. So these are those, they tend to be extreme, nobody likes me. Well, that's extreme. Is it really true that nobody, there's not a lot of people in the world who nobody likes, and most of them are in politics. They're not here. So, sorry, I'm American. It's getting dark right now. It's also everybody hates you. Yeah, that's not really correct. And during the meditation, if you moved a little bit, be like, oh, I ruined the meditation for everyone, right? It's like your thoughts tend to be your negative automatic thoughts tend to be extreme. They tend to be personal. It's all about you. And so in CBT, what you do is when you hear one of these thoughts, nobody likes me, you actually write it down, and then you take evidence for and against the thoughts. Okay, evidence that nobody likes me. I really feel like nobody likes me. Okay, that's not evidence, is it? All right, we'll cross it out. Okay, what's counter evidence? Well, my parents seem to like me quite a bit. I've been married for 4 years, so something's going right there. And get invited to parties sometimes. Okay, I guess plenty of people like me. Oh, somebody said something mean about me on Twitter. Okay, maybe that's some evidence people don't like me. So you go through the evidence, and then you write a new sentence that is accurate. So the idea isn't just to be optimistic. That I think will really fail if you try to just believe, you know what? I'm really great and everybody likes me. I do know a few people who are liked by just about everyone, but it's not that common. Most of us grate on somebody or people get upset at us for something that has nothing to do with us. So the idea is you look at the evidence for or against the idea that nobody likes you. And on weighing the evidence, you write down something correct, which might be a sentence like, while some people dislike me sometimes, I seem to be pretty well liked most of the time. And sometimes treating the thoughts this way, trying to essentially write smarter thoughts, will help the negative thoughts not seem powerful anymore. And if they don't seem powerful, they don't grab your attention, and then they don't really affect your emotions. The emotional state comes when the thoughts grab your attention, and they grab your attention because you unconsciously believe that they are important. So sometimes this idea of writing smarter thoughts will make the dumb thoughts look dumb, and then they don't bother. Another technique, so I'll always start with that technique. It's just easy and relatively painless. Another technique I'll use is trying to go into the feeling and see if you can be mindful of the feeling, meaning tolerate it. Okay, I know plenty of people like me. Somebody just said something mean about me on Reddit, and it doesn't mean the whole world dislikes me, but I really feel like the whole world dislikes me. And when I have these thoughts about the whole world disliking me, sometimes I yell at them, that's not true. And so the other thing I'll try to do is just feel the feeling. Okay, I feel like I'm totally disliked. What does that feel like? It's like, oh, my stomach is making a fist. My back is tight. I kind of feel like I want to vomit, things like that. And I go, okay, can I tolerate this feeling? Is this feeling okay? Am I actually going to vomit or something? It's like, no. This is an unpleasant feeling that I can handle. If you become able to orient towards the emotion, generally the thought will go away. Is the function of the thought, I tend to think, is to distract you from the emotion. Thinking about whether anybody likes you, that's ultimately pretty safe. For most of us, there are people around who like us, and so it's really safe to consider whether there aren't any. There are, right? The emotion feels much more unsafe, and so we get stuck in these obsessive thoughts up here. So the second thing I would try is feel the emotion. It's going to be lower down in the body, and see if it's okay. My example before was your belt is too tight. I can have a pretty good day when my belt is too tight. I get back pain sometimes. It can get pretty bad. I can have a pretty okay day with quite a lot of back pain. If you feel the emotion fully, invite it in and let it know, actually, I can handle this. In fact, emotion, if you want to get worse, I can handle that too. That will often make the negative automatic thoughts pretty much go away. Um, yeah, I could basically like you could take a whole semester class on that question. So I'll have to at some point just stop. So I think I'll stop there.
There was actually a follow-up question as well to that. And someone was just asking on the topic of automatic negative thoughts, would this be the same approach as anxious attachment in relationships?
I had to learn all the attachment styles for my psych exam, and then they didn't stick in my head. But I actually think anxious attachment is a lot harder to deal with. Um, Attachment is it's almost like the water that we swim in. As a mammal, your brain essentially has three directives, right? Uh, don't die, reproduce, don't upset the tribe. These are the three reasons you exist, right? Your ancestors didn't step on rattlesnakes, met some other ancestors and had a good time with them, and weren't excommunicated. That's why you exist, right? You come from 100,000 generations of people who did that. So I think trying to just be mindful of attachment is like trying to be mindful of hunger. At some point, like this is a basic survival need. There are people who become monks and nuns who can like be mindful of all sensual lust, who can go into seclusion, but it's not a path most of us, I think, are well suited to follow. One thing that I've seen for attachment that's been kind of trendy recently that I like, it's called the Ideal Parent Protocol. It was created by he died recently. He's called Daniel Brown. He was a Harvard professor and a Tibetan Buddhist teacher. And the idea, it's Tibetan deity yoga. So you imagine fictional parents, and they're either supposed to look like fictional people, or I have a friend whose mom I've only met a few times, and she just seems like the world's greatest mom. I'm sure if I knew her better, she'd be imperfect like the rest of us, But I don't know her very well, and so the other one I'll use is Dr. Jane Goodall. I look at her and I'm like, I wish you were my mom. Why was I born to some other woman? And so the idea is you picture these people and they're perfect parents. They're everything you ever wanted. They're perfectly attuned to you. If you get upset, they take care of you, but not too much. And so you spend time imagining you're around these perfect people. And over time, there's some pretty good evidence that it seems to start shifting the attachment pattern. Uh, in terms of one simple trick for anxious attachment, that's the one that I like. I have lots of non-simple tricks for anxious attachment too.
Great, thank you. Throwing it back to the room, if anyone wanted to ask, otherwise there's more questions online. Okay, all right, I'm going back to the questions online. So another question about thoughts, quite a few questions relating to psychology. How to deal with ruminating thoughts you can't shake.
Yeah, a few ideas. One is almost all thoughts are useless, right? If you look at the percentage of your thoughts that are smart and helpful, I don't know, maybe your thoughts work way better than mine. For most people that I talk to, that percent of thoughts that's useful, that's going to be less than 1%. Most thoughts are worrying the same thing for the 80,000th time, planning a future that may never happen, planning for a future that definitely won't happen, trying to get in a time machine and undo something you did in 1997, and on and on, right? Most thoughts are really unhelpful. The ruminative or obsessive thoughts generally you're trying to solve a problem in a way that that problem can't be solved, right? So often the problem is wanting to feel safe and secure. And so what we do is we think the same thing for the 10,000th time. Okay, I'm going back to the States next week. I have to cross immigration. Where's my passport? Is it in the safe? Should I really put it in the safe? You know, the safe's locked, but if I was a thief, I would go straight to the safe. Maybe that's the least safe place to put something. Maybe I should be carrying an Amir. They're pickpockets in Sydney. I don't know anything about this. And of course, none of these thoughts are making me any more likely to get home, right? They're just not addressing the problem. So uh, 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 maybe two ideas for rumination. One is asking yourself the question, how many times have I had this particular thought? My rule is if that number is larger than 9, I'm going to try to ignore the thought. 9's pretty low, right? Sometimes the number of times I've had this thought is like 900,000. Um, I have kids. I'm away from my kids. I really want my kids to be safe and behaving, and it just doesn't make them safe to think about. So this is a mindfulness activity. It's noticing that you're thinking and assessing, is this a repetitive thought? If it is, I try to get rid of it. And in this case, the idea of going to the emotion can be quite powerful. Okay, why is this thought so compelling? The reason the thought is so compelling is going to be an emotion, always, right? Okay, what's this emotion? It's fear. Um, I want my kids to die in their sleep at the age of 114. Uh, and I don't get to control those things, right? Okay, so what I have now is fear. The way I'm trying to solve this problem is thinking the same thought for the 100,000th time. That doesn't help. What can I do about fear? Actually, I can do quite a lot about fear. I can focus on it. I can tolerate it. I can do vipassana. I can break the fear apart into its components. Um, uh, I can focus on my own strength, things like that. So that's what I would try. If you've had a thought more than 9 times, try to completely ignore it. If it's still going, orient towards the emotion, see what you really need, and whether it's possible to give yourself that thing. It often is.
Okay. And a follow-up question, any tips on how to deal with quite painful emotions or dealing with very unpleasant emotions?
Yeah, the first thought is compassion. Um, you're a domesticated ape, right? The, no offense. The fact that you can feel your emotions as clearly and regulate them as clearly, that's actually pretty amazing, right? What is our genetic overlap with chimpanzees? Like 99.5%? It's really quite miraculous that you can sometimes regulate and heal emotions. If you believe that you should be able to always regulate and heal emotions, you'll be a very miserable person. Sometimes you will get overwhelming negative emotions that you just can't fix in the moment. And the the first thing I would try there is self-compassion. Self-compassion is really easy. It is imagine whatever you're feeling that somebody else is feeling, right? And well, my biggest negative emotion, the political situation at home is terrible. And it's not clear how long it's going to be safe to stay at home. There's all this talk of war and um, different minority groups that they're turning on. And um, so I've been afraid of that, of course, right? And uh, when you hear that I'm afraid of what's happening in the country, there's probably this kind of like warmth that comes from that. Like, you wish I didn't feel afraid, right? There can be this excess empathy, and that hurts. That thing where you hear that somebody else is in pain, and then you become in pain, or you see someone crying, and then you start crying, and now you need some third person to come take care of the two of you. The empathy feels bad, overwhelming, makes you miserable, and not very helpful. Um, but the compassion is this, for many of us, pretty automatic thing where we see someone who's suffering And we just like want them to feel better, even if there's nothing we can do to make them feel better. And so I would try turning that on yourself. One very simple trick is call yourself by your first name. When I think about Tucker, I have some suspicions about this guy. I have a list of improvements he could make. When I think about when I think about I and me, I have some complaints. When I think about some other guy named Tucker who looks just like me, I'm like, oh, I really want the best for that guy. He's really trying hard, and I hope his life goes well. So, uh, when the emotions get really strong, of course, there's not like one simple trick for all strong emotion. But if you're getting quite overwhelmed, this is what I would try. The belief that you can solve it, it's wrong and it's not what you would tell somebody else, right? If somebody comes to you really upset, you wouldn't give them a lecture on emotion regulation unless you're like a real jerk. You would give them a hug. You wouldn't talk about personal responsibility. So this is the kind of intention you want to turn towards yourself. It's okay to be overwhelmed. It's normal. This happens to everyone. It's not permanent. It will pass. And Tucker, or use your own name, not mine. I hope you feel better soon.
Thank you. It's really helpful. Again, anyone?
Yeah. What's your name?
Nicole,
Nice to meet you.
nice to meet you. You mentioned earlier the empathy thing.
Yeah.
I unfortunately take that on. So is there any way to kind of, or do you have a suggestion to guard myself or another person who has a bit too much empathy?
Yeah. The question is what to do about too much empathy. Uh, I I got almost incapacitated by this at some point, and meditation unfortunately makes it worse.
Yeah.
Meditation, um, I don't mean to sound too woo, but there's all sorts of sense data that we globalized people don't generally have access to because most of us just have access to thinking. And when you meditate and start letting go of thinking, you get access to like a lot more data in your mind and body. And one big piece of data is other people's minds. They're actually way more accessible than you thought they were. And while this sounds cool, like you're a telepath now, it's for the most part quite bad and overwhelming, makes it hard to be in crowds, can make it hard to go out. So yeah, I do have a few thoughts. Um, one mantra that I suggest for people who have this problem, the mantra is skin and clothes. What that means is when I look at somebody, I kind of get like their emotional state, I think many of us, you look at somebody and you get a sense of how they're doing, and then you start drinking in how they're doing. Skin and clothes is like look at somebody and ignore the information about how they're feeling. Just see the basic superficial outline of what they look like. So one thing is you're training yourself to actually ignore the data of someone else's emotions. Another thing which helped me a lot is if I feel like somebody else's pain is in my body, I imagine sending it back to them. Now, this feels terrible, right? You're like, I don't want them to have pain. You can digest your own pain. You can't digest somebody else's. It just gets stuck in your body like you've swallowed metal or something. I remember one time where somebody else had a big problem and I was so upset about their problem. I was just like in my room, miserable, and they had solved the problem. They were all better. I didn't know they were all better. I was, stuck in my room, feeling miserable about this thing that had become fake. So the opposite of empathy is boundaries, right? And one of the boundaries is everybody's issues belong in their own body. Part of why we drink people's pain in is we consciously or unconsciously think it's a good thing to do. It's a loving, helpful thing to do. And it's not. I went to a funeral one time for a 16-year-old who killed himself. And I was staying with the parents of the young man who died. And I was trying to breathe in as much pain as I could. I just thought, there's so much here. let me take some home with me. This sounds really woo. I don't know how to interpret this, but I got pneumonia. I was a young man who was not at that time susceptible to pneumonia. I tried to breathe in poison. I got pneumonia. And the family of this kid who died not one time said to me, thank you for getting pneumonia. It really helped our grieving process. You know? It feels like it's helping people to breathe in their suffering, but it's super not. So the idea of sending it back to them is two things. One is identifying empathic pain in your body and separating it from your own pain, your own issues. And the other is taking this ethical stance of it's not good to drink it in. It's so bad, it's better to send it back. I don't know how much of this is literal or how much is just visualization, but I like that visualization of sending it back. The third suggestion I make is getting really familiar with what it feels like to be you. Where in your body are your issues generally? So most of us will have some tightness in certain parts of the body that will feel familiar. And then you can start getting a sense of, huh, that tightness doesn't feel normal. That doesn't feel like me. And getting a sense of what it normally feels like to be you will help you get a sense of what's you and what's not you. And yeah, those are my tips for empathy. I hope that helps.
Could I ask one follow-up
Yeah, of
question?
course.
What you just said now, which is the feeling of you, the more I've practiced meditation and to grow and deal with issues that
Yeah.
the less I understand what is actually me. Like I have lost track of me.
Yeah.
And I'm like, you know, all of these external influences have caused me to be this. Or what is me? I don't know.
So in many Buddhist circles, that would be considered great. Like you could get a bumper sticker saying, I'm enlightened. I think this is bad.
It's hard to deal with life.
Yeah, that's right. I'm sorry, are you Lisa?
Nicole.
Not even close.
See? See? This is what I mean. That's my identity.
This is how Alice in Wonderland starts out. She wonders whether she's her friend Mabel or not. So if you spend a lot of time practicing, you may get access to this realm where you can be nothing and nobody. And there are some cool things about this realm. It's really freeing to be there. It removes death anxiety. You start to feel like, oh, well, I mean, this body's going to go away, but like the stuff I care about doesn't seem to be very related to this body. So, you know, who cares when they have to bury the body? I'm not going to, it's not my body. I don't know whose it is. It just seems to get older and work worse. So fine. There is this realm where you can be nobody and nothing, and there's some benefit. But like sainthood is about being the best possible Nicole, and falling into this realm of being nobody and nothing, as you started to notice, is actually pretty counterproductive. So what I would do in practice is pull your energy and pull your attention in. Anything that feels like non-self, forget about it. You're everyone. You're your parents and your grandparents, and this interaction is changing you. It's like, no, screw that. Like, you're just Nicole. You're entirely contained within your skin, and bring the attention inside to just feel it that way. Obviously, it's true that you are lots of things, influences, and like, it's also obviously true that no, you're not. Everywhere you go, when people know you, they say hi, Nicole. Right? It's a very meaningful to be one particular person. So that's what I would do. I would really try ignoring anything in your sensory experience related to non-self and pull back to like, what does your shirt feel like? What does your breath feel like? What is it like when you walk? Things like that. I wouldn't go back into ego transcending until you actually have no remaining questions about what's the difference between you and not you. The psychologist Ken Wilber used the term pre-trans fallacy for this, that the Buddhist texts talk about transcending your ego, but meditation for many of us, myself included, can put you into this place where you're more like an infant, like before you ever had an ego. You like don't really know what's you and what's not you. And Yeah, so I would pull back from that if you're able to.
Thank you. Someone also asked a follow-up question about the breathing in pain during the funeral and was asking about Tonglen practice as well in that situation.
Oh man. So I said, I wasn't susceptible to pneumonia at that time. Um, I since have lost one of my lungs. I don't have two lungs anymore, and so I have constant breathing problems, and I just don't do Tonglen. The idea of Tonglen is a Tibetan practice where, as far as I understand it, you're practicing converting converting pain, and so you do actually imagine breathing in pain and converting it out. One thing I could say is I don't do this practice. But the other thing, because I actually did ask a Tonglen teacher this question one time, because I was like, why do you breathe in pain? I'm trying to never do that again. And they said, well, you're not like holding the pain, right? You're like transforming it and sending it back out. Feel almost like it's like you're not inhaling, holding the smoke in your cheeks and sending it back out. But yeah, I don't do or teach Tonglen. I do think for people with poor interpersonal boundaries, it can be a harmful practice.
All right, thank you. Thanks for your question. Was there anything else in the room? Otherwise, there's a couple more online. No? Not yet. Okay. So someone asked, there's a lot of focus on meditation practice, but what about all the other aspects of the practice, such as the Noble Eightfold Path?
Could I ask a follow-up question? Like, well,
Sure.
what about them? You can unmute if you're there. Oh, is that you, Eugene? Okay.
Yes.
Hi.
Oh yeah. Hello there. Yeah. Thanks for all the teachings. Yeah. What was I was like trying to ask is that, like, there's a lot of attention and focus on teaching people to be more mindful, teaching people to meditate.
Yeah.
But all these other aspects of the path, such as right intention, right livelihood, right speech, it doesn't seem to be talked about very, very
Yeah.
much compared to other. Compared to like right mindfulness, for example.
Yeah. So if you pick up a copy of this shiny blue book, Sanity and Sainthood, available on Amazon or much cheaper in this room, it does go into Four Noble Truths, Eightfold Path. I think the reason that it's all meditation is largely cultural. When Buddhism came to the West, it was mostly being taught to people who ran away from Christianity and Judaism. And so the three trainings in Buddhism are morality, concentration, and insight, right? And if you are trying to make Buddhism popular and you're bringing it to people who are running away from Christianity and Judaism, and you're like, I have 2 years of lecture on morality before I'll teach you how to spend 2 years feeling your breath. It's not much of a sales pitch, right? And so I think that the focus on meditation has like a sales angle to it. I actually think that's okay. I've taught a lot of like MBSR, like short intro meditation. Meditation is just about relieving psychologic symptoms, things like that. And quite a few of the people I taught that to became serious practitioners, went on retreat, know what the Eightfold Path is. So I think that the hyper focus is a way of bringing people in the door, and that's a good idea. Marketing, yeah, the Dharma is good, and so marketing it is good, right? I think it was U Pandita, there was a Burmese teacher who came to Massachusetts and observed American Buddhism in the 1980s. And he said, it's like rowing your boat faster and faster without untying it from the dock. I thought this was a very good metaphor for the just meditation path. If all you're doing is watching your mind, this can actually make you go quite nuts. It's very important to know how you're watching your mind And also, you mentioned right intention in your question. It's the sixth of the eightfold path is you're not just trying to see what's there. If you're an angry, lustful, violent person, you don't want to just like watch this non-judgmentally. That's not dharma at all, right? You actually want to label, oh, lust, violence, hatred, bad. I can't turn it off, but I would like to have less of this. You should be in dharma learning how your mind works such that you can mold it and shape it and change it over time. It's why I call the goal sainthood rather than sanity and non-dual awareness, or the kind of thing that might come from simply observing how your mind is working. We probably have time for one-ish more.
question.
How many questions do we have left?
It's like at least 3, 4.
Okay, I'll try to talk really fast.
Okay,
We'll see if
Quick
anybody
fire.
can understand my accent at a fast pace.
quick fire round.
We'll
Okay, so
just do like a true or false round.
yes or no. So someone's asking that they once attended a Vipassana course and a lady started getting hallucinations. They're wondering whether you could explain that and also whether meditation can help with delusions.
For somebody who already has like true delusions, somebody who thinks they're Napoleon or something, meditation will make it much worse. Somebody with true delusions or hallucinations should not meditate at all. They're already confusing internal and external reality. Closing their eyes and ignoring external reality and just focusing on internal is a disastrous thing to do. I have seen that up close. Meditation is hacking your perceptual system, right? The Vipassana retreats, the Goenka inspired Vipassana retreats. Most people love them, are very glad they went, but I have worked with quite a number of people who've gotten hurt at those. I think the reason is two things. One is often insufficient supervision. There'll be 100 students to 2 teachers. The other is the lack of flexibility in the technique. There's just one thing, you do it. If it's hurting you, you're doing it wrong, do more of it. Somewhere on the Vipassana, there must be some Vipassana online group where it says if you get hurt here, call Tucker, because it's become like a minority portion of my career is people calling me that they had bad reactions at a Goenka retreat. Yeah, your mind does all sorts of things that you do not expect it to. And if you're doing intensive meditation, I mean, I've probably sat 30 retreats, or I don't even know how many retreats I've sat, a lot. And I would never do a retreat without a teacher. I make sure at least every other day I can talk to somebody and I have somebody on call in case something really wild happens. The dangers of meditation, I think if you're being properly supervised by somebody who has enough time to supervise you, actually knows you, and is flexible, meaning like if you're having hallucinations, they will say, stop meditating, leave the retreat center, get some ice cream, come on back, let me know how the ice cream tasted. They have to know you, have time for you, and be flexible in their approach. In that case, these terrible side effects of meditation are extremely low risk. I've had over 1,000 people sit retreats with me. I've had 3 people leave retreat worse than they came, and everyone got better within the course of a month or so. So that's like, what was that, less than 0.3% risk from retreat. And it's a risk of having a bad month or something. Whereas if you're unsupervised, just pulling your perceptions apart, the people can actually injure themselves for years.
Okay, thank you. All right, next question.
Yeah,
I
didn't go fast.
That's all right. How much have you been able to integrate Buddhism into your work as a clinical psychologist? Does the meditation teaching you do sit outside of that? This is coming from a fellow meditation teacher and clin psych student.
Oh, cool. Who's that?
Gianna.
Gianna. Hi. Nice to meet you. It depends on what somebody's coming in for. That sometimes people are coming in with rather pragmatic sorts of issues. Like if somebody's homeless or somebody has just separated from their spouse, like a lecture on the Eightfold Path is really not going to help, you know. You'll also get lots of clients who, oh, I have a podcast and I interviewed this British teacher called Vidya Mala. And she told the story of she's a teenager. She was in a surfing accident and became paralyzed. And she's lying in the hospital bed. And she said, and I started looking at my mind. And I realized up until that point, I actually didn't know that I had a mind. I just sort of thought, things happen. That many of the clients who come in, I think that's true. They don't quite realize that they have a mind. They just sort of, believe there is reality and perception of reality. So there are some people who are coming in with quite pragmatic issues where we deal with those. There are other people who are just not ready, for the kind of deep dive that comes from Dharma. But with most of my clients, if they stay long enough, we get there, If you want to go deep enough into your mind, things that aren't unique to Buddhism, but are pillars of Buddhism, mindfulness, equanimity, non-judging, clear comprehension. I will certainly wind up teaching people these things if they want to dive into their minds. It's almost like it's almost like the safety rope with which you can dive down into the mind. When I was applying to graduate school in 2007, I had a pretty good resume. I went to a good university and my credentials were good. And I was rejected from 27 grad schools over 2 years because I would go to all the interviews and say, I want to get a PhD in clinical psychology focusing on meditation. And everyone would say, that's not a thing. That doesn't exist. Don't ever call this number again. And the culture has totally flipped on that. Some of the most prominent schools of psychotherapy, dialectical behavior therapy, acceptance commitment therapy, internal family systems, these were Buddhists who tried to secularize Buddhism and turn it into psychotherapy. So I think in the last 10 or 15 years, there's been a real shift in public consciousness where many of the clients who come in are going to be aware of this. And teaching Dharma is kind of like therapy mainstream nowadays versus like, in grad school, we read a paper written in 1986 on science versus pseudoscience. And, science, the pseudoscience is this. And then there was one sentence about something so below pseudoscience, it doesn't even have a name. It's so bonkers. And the two examples were people looking for Bigfoot and people who practice meditation. So there's been a really big cultural shift. So it's pretty easy to talk Dharma in the clinic now.
Okay, thank you. There were 2 more questions. I'm not sure how much or whether we just close things off now.
I don't really have anywhere to go, but it is kind of late for a weeknight. So if you want to stay in touch with me, if you Google my name, Tucker Peck, you'll get my website. On the group retreat section there, you can sign up for my listserv. You can also follow me on Twitter, and we can stay in touch that way if you want. And I'm teaching a retreat outside of Wollongong tomorrow. So on the extreme off chance that you want to go on a 5-night retreat starting in like 12 hours or something, let me know like now. Otherwise, I'll be back. My plan's to come to Australia every 2 or 3 years.
Oh, okay, cool. Are you also traveling to other parts of Australia, or are you just doing the retreat?
No, not this trip. I'm going home. I was on holiday in New Zealand, so I've been away from my family 3 weeks. So it's time to go home.
Okay, cool. All right, thank you. So usually, if you'd like, we usually end off with like a closing, just prayer or something like that, or chanting, or however you like to close off the session.
May all beings buy my book.
Cheaper tonight.
Beings known and unknown.
There was actually someone online that was interested in getting a book, so
Cool. I never usually do these quick closing ones. Yeah, let's do a very short meta. Think of the easiest being to feel love for. I think the categories of grandparents, babies, and pets might be easy. I have a 3-year-old. She's often misbehaving. I'm just totally in love with her all the time. It doesn't matter how she's acting. Bring to mind a being like this. If you don't have one in your life, you can bring to mind someone you know of. Maybe like the Dalai Lama, somebody like that. But if you have somebody in your life, it's just so easy to feel good things for. Picture them in front of you. And you'll feel that sensation in your heart. And now, keep that being in your mind's eye and go stand next to them. There's now 2 beings in your mind's eye. This first one and yourself. You might see the similarities between the 2 of you. You might see the way this other being feels about you must be very positive. Take a minute to look at this being that's so easy to feel love for and yourself. Thanks so much for coming, everybody.
thank you. Thanks, Tucker, for coming. There's a couple of thank yous online as well. I'll just finish off with some announcements too. So our regular events, yoga classes here tomorrow, and then Jim Teo will be giving a meditation class on Wednesday at Parramatta. There are monthly workshops with Aya Karunika, and also residential meditation retreat with Ajahn Yu in May. I think those are the main announcements. I think Rod Lee will be coming next Monday as well. So feel free to join for those events. And yes, thanks everyone for coming online, and thanks for all your questions. I'm sorry for those whose questions I didn't get to. And Sintin, did you want to make an announcement?
No, it's okay. I just wanted to say hello to Tucker. I promised I said hi, Tucker. I was the one who invited you through, I mean, indirectly, but through Kainan. And I was going to actually attend your talk and meet you in person, but they put me on standby, so I have to work, unfortunately. Sorry. But nice to meet you virtually. I hope Kainan is there, right? Hi, Kainan.
Hi.
Hi, Kainan. So thank you so much, Tucker, and welcome to Australia.
Thank you.
Yes. Yeah. Bye. Since by the way. Yes. That's all.
Okay. And just a quick question to Ben. Did you want me to grab a book for you? If he's around, just let me know.
Yeah, I'm not doing some kind of fire sale. It's just if you buy it on Amazon, you have to also pay Amazon. And if you buy it from me, you just have to pay what the book costs.
Okay, no response.
Okay.
Okay, all right.
Was that for me? Sorry.
Yeah.
So,
Oh, yes, I'm in Brisbane though, so Tucker, maybe easy for me to get it on Amazon.
Yeah, the other option is I can grab it tonight and send it off to you if you like.
Oh, yes, please. Thank you.
How much is it in?
how much is it?
28.
28.
28.
And I can sign it for you too, Ben.
Benjamin Wong.
Yes, that'd be nice. Thank you.
Okay, great.
Thanks,
And
Dr.
if
Tucker.
anyone else wanted a book, just
Well,
let me
that's
know
how
as well. Or
it's
just
made.
message me in WhatsApp because I'm going to close the room.
Oh, it's even worse because not only do they have the huge markup, but they're taking some of my money also. It turns out if you're the biggest store in the world, you can treat your vendors as badly as you want.
Amazon. Okay. All right. Thanks, everyone, and good night. Thanks.
Bye, everyone.